great to be here and to be here with my colleague Anne and Dr. Atul Gawande and Monisha, all of whom are partners in the Transform Health Fund. I'm trying to keep this on the annotated we missed, but it's quite, as Anne was describing, a broad partnership. It really began on two parallel tracks. One was Philips, the Dutch healthcare company, that was recognizing that there needed to be a build out in the primary care area in Africa for them to actually be able to do their business. And that, that they have amazing, just like Roche, technology that can make a real difference on the ground. The work, the clinics, the hospitals, the referral chain, the supply chain to get those products to the people who use them best. And on the same side, there was the ambassador for global strategy of the World Health Organization, Ray Chambers, who was recognizing that if we're going to actually achieve SDG 3, we have to mobilize a lot more capital than what's there together. And these two folks came together with the idea that we need a financing vehicle that can really tackle the challenges the obstacles to the mobilization of capital. And those obstacles, basically, I'll mention three of them, and how the structural fund is designed to address them. But they're all derivative of the fragmentation of the health market. Fragmented on both the supply side, with lots and lots of little enterprises that don't tend to get to scale, and fragmented on the demand side, where you have a whole bunch of payers who are stuck in their stovepipes and aren't, in essence, leveraging their financing to create efficient, effective delivery systems. So one of the things that was clear when we began our work was the recognition that while the needs are vast, the opportunities to invest are actually somewhat limited. And so what you need is what we call a construction function to help develop the opportunities that exist into investable opportunities. And so as part of the Transform Health Fund, there's the Health Finance Coalition's construction effort, which really takes grant-funded technical assistance to build up opportunities that have promise that serve the bottom of the pyramid, but that aren't quite yet investable, but can be investable with time. The second, and Anne mentioned this, is the fact that there are many opportunities to make a real impact in the health sector, to have sustainability, financial sustainability, but they don't necessarily hit the typical hurdle rates, the type of hurdle rates that Bruno was referring to with regard to what investors are looking for. So you need a blended capital structure with lower cost capital mixed with more commercial capital that could allow entities that could be sustainable but not necessarily deliver 20 plus returns, still achieve finance. And the third element was to focus on self-liquidating exits. So, a lot of the types of enterprises we're investing in, including several public-private partnerships, they're not going to have a sort of trade sale or an IPO or something like that. Instead, the focus of the investment is on things that can generate cash flow over the long term, perhaps by leveraging donor financing, by leveraging government finance, concessional financing, and using that to give the investors a reasonable return and deliver the type of impact that will make a real difference on men, women, and children on the continent. So thanks a lot. We're very excited by yesterday's announcement. It's just the beginning, but we're looking forward to a lot.